Hear your voice. I believe we're speaking to you from Ho. Is that correct?
That's correct.
And how are you doing this morning?
I'm doing well. Yourself?
We're doing great. Still very concerned about what's going on in the areas affected by the dam spillage. The stagnated waters, we're told, could pose very significant health risks and hazards to us all, not just for the people in the communities affected. So please, what is it that the people are experiencing now? We're told a cocktail of contamination. Paint a picture for us, and let's go into what the implications could be if something isn't done as a matter of urgency.
All right. Good morning to your listeners, and I want to begin by expressing my deep concern and gratitude for the opportunity to address the public health crisis that has unfolded in the Volta region following the Akosombo Dam Spillage. Yes, indeed, the flooding resulting from this unfortunate incident has led to severe consequences that has affected various communities, having some of them being displaced. In my conversation with some individuals on the ground, and as a public health practitioner, we deployed a team of health workers to be on the ground to assess the issue. And it is indicative that there are public health concerns which needs to be addressed as soon as possible. And so that is basically what is happening at the moment. And just for a bit of clarification, I'm a public health practitioner and I'm a student in medicine. I'm here to graduate as a medical doctor. So I'm not yet a medical doctor.
Incoming doc.
Yeah, incoming.
Sure.
All right. So that is just by the way. Our team has been involved in diligent monitoring and evaluation of the situation. And our report on the grounds reveal a disturbing increase in the cases of waterborne diseases, such as cholera and typhoid. And amazingly also, we have the ministry has responded to some of these issues where the government as a whole has also set up an inter-ministerial committee to be able to oversee these issues.
That's right.
There have been other NGOs, there have been other benevolent individuals and personnel that have come on board to donate to these individuals. But yet still, the issue has to do with the fact that now, when this spillage occurred, most of their latrines got submerged with this river. And these individuals are also bathing with this same water. They are also cooking with this same water. They are not drinking the water though, but they are bathing and at the same time cooking with it. And
Abraham, sorry, bear with me, please. You say the contaminated waters, as it stands now, whilst the residents might not be drinking it, some are actually cooking and washing with it.
That is it. That is it. That is what is happening on the grounds. And it will amaze you to know that for me, I feel like as a country, we are joking when it comes to issues of health, in the sense that on Friday, I had some few discussions with my team on the grounds. We later engaged with some individuals also. Per our discussion with the district directorate for Central North Tongu, it was indicated as of yesterday, they deployed their team, that's health workers, to come and assess some of the issues which has been raised. And these issues are not only raised by individuals or public health experts, but you will notice that the Ghana Association of Medical Laboratory Scientists have raised issues concerning it. The Ghana Medical Association has also raised issues concerning it. The team came only for them to just check their temperature, the areas that has been alarming that there could be a possible public health impact of whatever that is happening. Check their temperature and check their BP without even taking out samples to test them. But my team, health workers on the grounds, managed to take some samples. We assessed them. And it was very indicative that cholera was very significant in these communities that has been affected. An example could be Vume in Bato. That particular community, we've been there. And as at this morning, I've also deployed some team of health workers to also go there and to also ensure that they assess whatever that is happening. Some are also reporting issues of having itches on their bodies. And even children are also having rashes on their genitalia, which, their private part, which is also a concern which we need to look out for. So basically, that is what is happening.
Sure. Abraham, you talk about the itching in the genital area. What is that indicative of?
That has to do with skin rashes and fungal infection,
Mm.
and even what is happening also. These are not just anticipatory comments, or these are not comments that we are anticipating as public health experts on what is going to happen. This is what is happening on the ground as we speak. Um, the health directorate also deployed one particular doctor who came on board and also assessed the situation. And he also gave the diagnosis that this is a fungal infection. And that is what is happening on the ground. You
Mm.
see?
Now, Abraham, let's use a traffic lights color system, for example. Green being mild, amber being cause for concern, and red being quite alarming. Where would you put our situation now? Are we at amber? Are we already at red? Or are we close to red?
We are close to red. We are not at red as we speak. We are close to it. As at this morning, the health team that I deployed to go to the community indicated that the water is receding, which is a good indicator that at least something positive will come out of the situation for them to go back to their normal lives. But you see, when it comes to issues of health, when one is predisposed to a particular infection or microbe, it doesn't instantly happen that the person will begin to experience the signs and symptoms. In some cases, it will happen. Some of these microbes can stay within the body, incubate for a while before various symptoms may show up or signs may show up. So it is very alarming to the sense that I myself, together with my team, we are wishing earnestly to call on the Ministry of Health and Ghana Health Service and also the government to ensure that despite that, we have this interministerial committee that has been set by the president.
That's right.
And you'll be surprised that this committee that has been set by the president is a 30-member interministerial committee. We don't have even the Ministry of Health on it. I'm not talking about having a minister per se, but having the ministry representation on that particular committee is going to give an indication for other health advocates, other associations, other group of individuals or the medical association to come on board, liaise with the Ministry of Health to see how best they can address this issue.
Now,
and yes.
Sorry, Abraham, carry on, please.
Yes. So what we are recommending as we speak is that to be able to alleviate this current situation and prevent further health-related issues, there should be provision of safe and clean water. Now, individuals, benevolent NGOs are coming on board. They've donated to the various communities, the campouts that we have within the enclaves of where the victims are. The MP for North Tongu is doing so well. They are doing so well by calling on people to come. But this is the time that we need to get a lot of drinking water for these individuals. They cannot be using this same water to bath. They cannot be using this same water to cook. You can't say that because you are heating the water in the process of cooking, so you expect that certain microbes will, die and you can be able to consume it. No. So that they need adequate clean water, which is the fundamental human right. And in the midst of this crisis, it is just imperative that we ensure that the affected communities have access to safe drinking water. And this is the basic necessity that safeguard public health. Also, deploying medical teams to these affected communities should not be in the case that these teams will just go assess by just taking temperatures and taking BPs of this individual. Take samples for you to be able to ascertain investigatively to understand the public health concern or to get the underlying factor of whatever that is happening and whatever that other health workers are talking about or health experts are talking about, is for you to do a test, an investigative test. Samples, 2 samples, there are other samples that can be taken to assess so that these issues that we are talking about, they can have a clear understanding of whatever that is happening. And these medical teams must conduct health assessments, the necessary medical care, administer, if necessary, vaccines that could mitigate any forthcoming disease. For the public education also, it is important. What we are doing that as we speak, that was on Saturday. I had to be in one of the communities in in the Volta region, that is Mafia Megakope. It is far from the domain of where we have the victims, but I'm in conjunction with and in talks with the chiefs of Mafia and also Bato, which we are putting our resources, our logistics together to do free health screening for these individuals. And we will give this information to the Ministry of Health. We are going to share this information with the Health Directorate. And we are even going to work hand in hand with the Health Directorate so that the necessary things that need to be put in place should be done. And information, as we speak, is a powerful tool in combating the spread of any waterborne diseases. We must engage in an extensive public health education and awareness campaign on water purification, the various traditional methods that these individuals that are affected can be able to use to be able to ensure that they practice the necessary hygiene practices, and also ensure that we empower the community with the knowledge they need on not using this particular water for their basic. You can use it for even with washing. Okay, with washing, there's a question mark to that. Depending on the soap that is being used for the washing, there's a question mark, because when you wash, this is the same dress or attire you are going to put on. Okay, this is the same clothes you are going to put on. So
right.
it's the situation which every hand must come on deck to understand that managing this crisis of this magnitude comes with a significant challenge. Yes, absolutely. So we need to remember that the safety and the well-being of the affected communities are very important to us as a country.
Absolutely.
Thank you.
So in terms of the public education, you say that water should be avoided. No, even if it's being boiled, it should be completely avoided, because again, it's early, we haven't had our breakfast, but this is water that is now contaminated with fecal matter. You have decaying livestock. There were some morgues and cemeteries that were actually washed away, so you have human remains also stewing in said waters, pit latrines being washed away. So this is not the kind of water, even if you boil, you should get close to. Now, Abraham, there are some calls for the president to declare what is happening as a state of the areas being in a state of emergency, and that will hopefully trigger some of our international friends, shall I say, to come to our aid. Do you join in those calls that a state of emergency should be declared as a matter of urgency?
Yes, I join that. I call for an immediate inclusion of the Ministry of Health as a matter of urgency, and also looking at the effect of these floods. Also, this issue is a state of emergency, so that we see how best we can be able to address them. Sometimes it will amaze you that you can be exposed to some microorganism. You know, when you're talking about the molecular mechanism of how these microbes work, you will come to appreciate that sometimes they can be within your body years after, 2 years after, 10 years after you begin to have, the symptoms of this. So it is very important that as a country, we declare a state of urgency to see how best we can include the Ministry of Health as a matter of urgency to the interministerial committee that the president has set, and also to ensure that these public health issues that have been raised by various individuals, various associations should be taken into consideration.
Absolutely, because as you've mentioned, if people who even go and visit and cover, you have reporters, you have service personnel, you have journalists going in there, they too could also be affected, carry some type of, like you say, disease with them, and bring that back into different regions, bring that back into the capital and beyond. And then we have a real crisis on our hand because we haven't been able to contain what is going on. What about the water itself? I've heard other health experts say the water should actually come and be removed from the communities. How do we go about that? Is that an option? Is that something that should be considered, to come and actually scoop up this contaminated water to dispose of? What do you make of that?
You see, I'll leave that to the experts to speak on and how they are going to drain the entire water within the communities that have been affected. See, this is not the first time that VRA is spilling water from Akosombo Dam. Spilling was done in 1966, was done in 1967, 68, 69, 70, 71, 72, 74, and 1991. And recently also we had it somewhere in 2010. And now we are expressing it. You see, the data from, for example, GMET shows that some countries receiving above normal rainfall. This means that these communities, as we speak, may experience such things as well. But what happens that if we have a downpour and we still have this flood within these communities, the water level will increase. And experts have gone to check the level of this water. And so perhaps they may have, mitigating measures to ensure that they may drain. But if you drain, for people to come back to their livelihood is going to be very difficult, because most of these individuals have their farms, have their homes, have their even health centers. Some of the health centers were submerged. Their latrines were also submerged. And, I'm much more concerned about the public issues, because having submerging latrines often leads to mixing of the sewage with the flood water. And this contaminated water will infiltrate into local water sources, including our wells, other rivers. And as a result of that, residents may consume or may use it with their cooking, and predispose them to bacteria and other harmful pathogens, significantly increasing the risk of typhoid, dysentery, and cholera. So that is the issue. That is the issue.
Abraham, a very worrying angle that you've introduced there, that some of these contaminated waters could even seep into other water bodies that other residents are using to cook and wash and all of that. Now, yes, we've talked about the typhoid, cholera, waterborne diseases, but we're also hearing that other ailments such as hypertension, issues of high blood pressure are also seemingly on the rise. How do we connect the two? Is it the pressures of what is going on, the mental pressures of what these residents are having to deal with? Would you say that is a direct correlation to what we're seeing?
Yeah, there is. And this issue has a direct correlation to psychological and social impacts. You see, when floods normally have a profound psychological impact on individuals and community. The loss of properties, livelihoods, the distressing life condition in the aftermath of the flood, even as they experience it now. Others are having issue, feeling stressed, anxiety, other mental challenges, and that also predisposes one to high blood pressures and so on. So the psychological impact and the social impact of whatever these residents are going through, my dear, when you come to the grounds and you see what is happening, it's different from sometimes what we see in the media. People are going through a lot. Yes, people are sending helping hand to these individuals, providing some beds, providing some resources, and other things. But the psychological impact, and as at Saturday, especially in Vumebato, about 85 households were displaced. The following day, just to follow up with the team, it came up that 5 has added more. Now the number has risen up to 90. That should tell you that there could be some families that because of the situation they cannot even come out.
Right.
So the psychological impact also is leading to people having high blood pressures and affecting them. So this is the call for us to ensure that there should be some form of public health education as a matter of urgency. With this public health education, it is going to enhance that these people it's going to be like a support cushion to these individuals that are going through the stress, anxiety, coupled with the issue of the flooding affecting their livelihood.
Abraham, very worrying indeed when we think about the implications of what has happened, especially as far as public health is concerned. And I can hear the worry in your voice this morning. This is not something to play around with. You say we are close to that red mark. We've gone from green to amber to red. And you say the president should declare a state of emergency so we can mobilize as much resource as possible to get to these affected areas. So the public health information also very important. So we're grateful that you're able to join us this morning and keep on hammering on what needs to be done. I'll give you the final words in 1 minute as we wrap up on this conversation.
Okay, I thank you so much. I strongly believe that your prompt intervention as a country, the ministry, the government, and the collaboration with relevant stakeholders will go a long way in alleviating the suffering of the affected residents and preventing further harm. I want to take this opportunity to pledge our support, the Visionary Norman Foundation, our support, resources, and expertise to assist in any way possible to help remedy this situation swiftly and effectively. Our foundation is ever committed to creating a society where everyone has access to essential needs, healthcare, equal opportunity for growth and development. And this aligns with what we intend doing to ensure that the issues of public health that have been raised can be addressed collectively as a whole. Thank you so much.
Incoming Dr. Abraham Norman Norte, public health practitioner. Thank you so much for your time this morning. More grease to your elbows, and hopefully before the weekends we can connect again and see how things are going. Very grateful for your time. Thank you.
Most welcome.
Very troubling indeed. Thinking about the health risks that we're now all facing, because it's not just restricted to that area. We heard from incoming Dr. Abraham speaking about the health implications for reporters who've gone out there, for journalists who've gone out there, for NGOs who've been out there, private bodies, government institutions, government workers. They could potentially have opened themselves up to a world of harm, be carriers of
the diseases. And clearly it is now looking at how the extensive damage has been ill-assessed or lack of not anticipated enough. Clearly, government agencies, the organizations who are handling this are not seeing how big a case this is, how big of a situation we have on our hand. If this public health emergency that all of them are warning about, all of the agencies are warning about, if it is not dealt with immediately, then we have a whole region and some other regions also beginning to suffer from the effects of these things. My concern is for the affected residents themselves, how much education is going to them on what to do now. So they don't have the resources, they don't have water, they don't have enough food on their hands, but they need to feed, they need to drink. So human instincts, you'd go with what you have. But
that's right.
How far is educating them going that don't do this, don't do that? Although you're in this situation, try and do this, try and do that. So
good point you make, Crosby. They need to drink water. It's a physiological need. At some point,
human, you drink it,
you crack. But again, as Abraham said, the waters are very much contaminated. Boiling it could not be enough, even if it's for the washing of clothing. Now, I asked him about the state or the president declaring a state of emergency over the weekend. If you tune into any of our political shows, Viewpoint in particular, Lawyer Martin Pembu was on there speaking about the president declaring a state of emergency. I had Honorable Ogututu Ablako on a different platform talking about the implications of the president declaring
National Association
of Teachers. Because I recall last week I was even asking William, what does that mean in practical terms if you declare a state of emergency? I even thought that was supposed to maybe aid government in bypassing certain cumbersome procedures to release monies. But listening to Honorable Ogututu Ablako speak, he says, and he's a ranking member on the Foreign Affairs Committee, he says in speaking with some of his international parties, so what they're saying is, well, if your president declares a state of emergency, it will then help them be able to trigger some of their relief laws to give us money. Then they don't have to go through cumbersome processes. If there are any restrictions that are placed on us, if we do so, I think maybe we can get some education on that. But from where I sit, I did my Googles, if you will, I did my little research. I couldn't see what sort of adverse effect would come out of us declaring a state of emergency. Maybe there's something. Does the IMF prevent us maybe from receiving some donor funds? Is there anybody who can let us know why?
Communicate with us. Let us know why maybe you think we're not there yet, so that we will rally behind you with the.
I hope it's not an issue of pride, because at this point we're at the IMF, and I think it's even easier for us to say, look, Charlie, we're hard up, we're at the IMF, so if you have some support, come to us. Because if that's what is going to help some of these external friends, other countries kick into gear and give us some money, I think we need all the support we can get. William?
In fact, this incident in the parts of Water region and Eastern region and the other affected areas,
the Western North region,
all those the stories are already in the international media.
Al Jazeera covered it. In fact,
Chinese are reporting it.
I see.
Yes, I mean, if you check, it's the Jinhua, it's all there. And so, for us to even make an open request for international support. I haven't heard that officially happening. If the president has sent some SOS messages to, say, the US, the Europeans and the Chinese to come and help, I haven't had any. I don't know, Crosby, if you've heard any official.
I've not heard any call on
point on that.
Official call on other international
because
organizations to support.
The situation is very, very dire because it is not a natural disaster, but it has happened in a way that is akin to a natural disaster. And so, if we don't have the resources on the ground to take care of ourselves,
which clearly we don't.
So why don't we just open up and ask for help? Because you see, that area is not. Mepe and Sugakope and those areas are not. Does not have people who are so, if you like, economically, up there in terms of finances and resources. A lot of them are farmers, fishermen, and petty traders and stuff like that. And to think that they've lost everything, the government should be doing more than it is doing. You understand? So if we look at the fact that even after the flood waters have receded, the medium to long-term effect on them, are we planning that? That's what I always say. Because poverty-related illnesses exist.
That's right.
And these people have been knocked off their livelihoods, and so poverty is going to set in afterwards. What's the plan if the flood water recedes? That we're going to let them go back and do what?
Their houses, the structural integrity of their houses.
We're not having that conversation. And we shouldn't wait till it happens before we talk about it as media. We should set the agenda for the government and everybody else to know that even if between the 4 and 6 weeks that are being predicted for the water to recede, what are we doing for the people? What they are getting right now is just relief items for the short term. In the medium to long term, what is going to happen to them? Because I've been to Mepe before. If the flood waters recede, are we saying that immediately they can go about their farming and their fishing and their trading as it were before? No. So from now, between now and 6 months to 1 year, how are we going to help them to come back? Do you have insurance packages for each and every single family out there? Education, jobs are no. Already we don't have jobs. Yeah. And so that's the conversation that I think we should be having. Having said that, the point he made about those visiting and what they can even come out of the place with is something that we haven't looked at.
That's right.
Because people go there with Wellington boots, they step in the water, do reports from the middle of, the floods, and then get out and come back without any disinfection and stuff like that. So it's a very good call for everybody visiting the area to be conscious of what they are doing and what they are touching. And to think that people will use the water to do washing and cleaning and stuff like that is something that shouldn't happen. VRA is saying that they are going to restore, the water treatment plants around one of the affected areas as soon as possible. They put out an advert listing what they've done for the people.
Sure.
And the water treatment plant was one of them. We just have to follow up and make sure that it's done in the short time so that the people can have some respite in terms of their, access to water.
Now, as we chart the way forward, we're still looking for answers, are we not, from the VRA to find out exactly, as they say, they're not overwhelmed and they're going according to plan. I'm sure many of us would like to be privy at least to what some of these plans were, and we can put that against what is happening now, and we can judge for ourselves if this has been competently handled. Because I think there are some questions to answer, a few things that are not quite clear.
So what the VRA is saying is that they are collaborating with NADMO to provide food relief items, including bags of rice, cartons of mackerel, cooking oil, tomato paste, soft drinks, biscuits, powdered milk, mosquito coils, palm oil, toilet rolls, beans, gari, granules, sachet water, etc. They are deploying tankers to consistently make water available in affected areas. They are also providing medical items and personnel to screen and administer medical treatment to emerging health issues. And they are providing buses and pickups to assist in the internal transportation of both goods and affected people. And they are on all that, saying that they are going to restore the damaged water supply system in the North Dong district. This is coming from the VRA. And so if NADMO is receiving all these and they're also assuring the people of North Dong that their water system is going to be restored, that should be done as soon as possible. And we should monitor to ensure that it is done, because this is just out in the media. What shows that is going to happen? And they are saying they are providing buses for the transportation of the affected persons to where? That's the question I was asking.
You know, Helen,
where have they prepared for them?
Right.
If we're looking at the extended version of this disaster, we know the affected areas, the areas flooded and all of that.
Right.
But there are families who depend on the affected areas, maybe who are not living there for survival. Maybe your parents are working in Mepe, they are farming in Mepe to feed you, who is in another island community that has not been affected by the floods. Your family has been affected by the floods, so the money is not coming. How do you survive? That's also something we should begin looking at. There are communities that rely on the activities in Mepe for survival, in the adjoining communities for survival. But if the primary victims of this disaster are not able to get out of it quickly enough, then what happens to the extended areas? That is also something that we should look at, because if, for instance, Andy Apia Kubi, whose rice farm was submerged in water, if that is what his family relies on, then what happens to the family then? Maybe the family is not in the farm, maybe the family is not in the Volta region or the other communities affected by the disaster. But if they depend on the proceeds or the resources from those areas, then how do they survive? That means the relief, the support, the help that is coming should be extended to a lot of communities. It comes back to a question of assessing the damage and properly quantifying the help that these people need. And it is not looking as though that is being done enough yet. A lot of people still living in various areas close or far away from these are bearing the brunt of this disaster.
3FM Sunrise.
And we're still asking you to lend a helping hand. Join Media General and the 3 Foundation as we lend a helping hand to give hope to the residents of the dam spillage affected communities. So please, if you're able to, donate clothes, mattresses, blankets, provisions, toiletries, and food items to the Media General and 3 Foundation Dam Spillage Relief Fund. You can send cash through the 3 Foundation account, Zenith Bank, Ghana Limited, Kojo Thompson Road, Tudu. Account name is 3 Foundation. Account number 6010603927. Sort code 120104. You can also send donations through on our Momo line 05974331110 or the merchant ID 120490. But fear not, I'll plug those numbers again before we bid you farewell. We're already getting your donations coming through, and we